So as I said before, welcome back. This is the season finale of the Health and Risk Communication webinar series. It's my pleasure to talk today about generative AI for health promotion behavior change campaigns. I'm going to share some of my tentatives approaches to generative AI. I'm an academic integrity officer, so I have also another hat here, but I'm really much more the campaign designer or the social marketer developing interventions here. So I based my talk around some experience of putting together workshops and interactive sessions in the past year or so, starting from a workshop at the World Social Marketing Conference in Alicante in November 2025, when we tried to use ChatGPT as a tool to support the creative production. And then I had a masterclass on generative AI for campaign design in the American University of Beirut, Lebanon, where I was based a few years ago, with the students from the health communication bachelor in health communication. And then I had a session in the International Conference on Integrated Care about AI use in integrated care, so community and social care involvement. Then I have also another session planned for next week in the European Social Marketing Conference on the generative AI for creative development. Again, here we're talking about how we can use generative AI to help us think strategically in the operational delivery of behavioral campaigns and health communication campaigns. So of course, we know that AI and generative AI use is increasing across various fields, including social marketing. This is a paper that we wrote. Sorry, you cannot see the picture now for some reason. It's referenced below. So in the marketing, in a piece that was published on Business, my colleagues and I reflected on the use of AI. We looked at how social marketing and health communication professionals can use AI to support their work in different areas. So there's a central tenet here about the role of technology to support the development of campaigns. Of course, we are talking about campaigns that are supposedly creating social and personal good or societal gain. So we can get insights from people, from end users, for participants, call them whatever you prefer. And we try to sell or promote behaviors, not products or sales. We want to encourage that. So we can get the audience insight by segmentation and evidence-informed understanding of real people. This is what social marketing is about. Then we can use AI to help us in the definition of the exchange and the value exchange, and then define the benefits that the people, the participants, the target audiences feel about the target behavior and the competition. And then there are 3 levels of action that we identify. So at the policy level, at the strategy, and then the operational delivery of intervention. So let's take a look at these in a moment. So in the paper that Professor Jeff French, Professor Douglas Evans and I wrote a few years ago, we reflected on these 3 elements, these 3 areas. So policy, so the upstream social marketing, if you want, approach, so where AI can help us synthesize insight and shape policy opinions, for example. Then there's a midstream when it's strategy. So as developers, we think about how to define a strategy. What are the objectives? How we can leverage information we collected, the insight we collected from target audience. How we can use that information to segment and to prioritize segments, and then eventually design messages according to that. And then eventually the downstream element is about the delivery. So we think about communication campaigns, particularly that reach the majority of the people in our target segments, and the way we can provide support to individuals and maybe groups or communities based on information we get from during the process. So of course, AI has been used and is being increasingly used in advertising as well. So in commercial advertising, commercial marketing, for campaigns that are currently run. So you might see examples on social media, might see examples also on print and traditional media, and you might start seeing some AI generated visuals and images and saying, well, is this really accurate or appropriate? I'm not sure. So this is the point I want to make, is we need to open up our eyes and our ears when we see something online or not on offline. Think about who's behind the campaign. Think about what is the purpose of the campaign, what do they want us to do or to buy or to acquire. So when you talk about social marketing, we see that AI has different opportunities and risks. So for policy development, the opportunities are, of course, that we can synthesize a lot of information about citizens, about the views, and we talk about big data crunching. So imagine we are running a series of events or public engagement activities. As policymakers, I'm thinking, the government, we want to synthesize this information. I was yesterday at a conference on building capability on behavioral research, UK in Birmingham, and there was an example of how a group used AI to a copilot agent to collate information and to come up with a sort of a brief, a policy brief. Which is very useful, takes a lot of time to distill and synthesize a lot of information, especially if it's from disparate sources. This is very useful. At the same time, there are probably risks and limitations in a sense that because they're generative AI, we don't know exactly how they think. Or they don't think. Generative AI is producing a response that is statistically plausible, but not necessarily correct from a content perspective. So there's bias, of course. There's algorithmic bias built in the machine, in the model, and then there's the bias of those who developed the model itself, and then there's a bias in the data that they used to train that model. So there's probably the risk is that the responses and the summaries, the synthesis might be still, partial. They might identify the most recurring themes that are already present in the data set, so they recognize something that is statistically present in the data. So there's over-reliance also on automation. So if we don't bring the human in the picture again, we risk of having a partial view of reality. And when it comes to a policy, that might be a problem that we need to really face clearly. Now, when it comes to strategy development at the midstream level, so of course, using condensing data from, let's say, focus groups and interviews and surveys to understand what are the psychological determinants of a behavior or the barriers that people perceive towards it, and the understanding the competition, what are let's say the alternative behaviors that people undertake or choose instead of what we propose, might be very useful, to have a tool that condenses this information, say these are the salient beliefs that people have, and we can address them, and to formulate also valid propositions in terms of value exchange, drafting key messages, proposing an idea there. I'll show you later a few examples of something I ran the other night with two generative AI tools. So to give an idea on a real example how this could be done. At the same time, as I mentioned before, the risks and limitations of this approach is that the outputs are somehow producing a stereotypical view of reality that might be, again, biased because of the training material. So if you use in public generative AI tools, this is very much a risk. If you're using a closed GPT or a closed agent system where you trained the software with data that you own, and then you can somehow control, and then you remove the biases, or actually you create a system that is bias free, or as much as possible, then you remove the risk, or you minimize the risk of hallucinations and biased views in the messages themselves. And you can correct and provide feedback, of course, to the machine, to the tool, to improve itself, to self-criticize. That will help the output becoming a bit more appropriate, let's say. And of course, then when you're talking about engaging with an agent or a bot, a chatbot, we're talking about the synthetic profiles, right, of ideal people. It's not really talking about the actual people. So that might also introduce some limitations in the outputs that you have, but you need to be aware of that, I would say. Now, in terms of operation delivery, so if you develop a campaign, a strategy, and then you develop the messages, you can also run a campaign and schedule things through AI, so that you can delegate some of the tasks to a machine, to an automated agent that does some things in the background, so that you can focus on other things more important. Of course, oversight over the campaign delivery is important, as well as the strategy. And so you can focus on, let's say, engaging with clients or participants in your study that are particularly keen on engaging in a one-to-one discussion, maybe with a human, not with an agent. You can provide personalized nudges and prompts based on the characteristics of your target audience, based on the needs they expressed, and so on. So, and you can build the dashboards, let's say, to monitor the progress of the campaign, of the messages that you fire. You can also do some interesting testing of different messages to see which one is more um, uh, it attracts more attention. And so you have real-time data collection and evaluation that can be built in through, it can be done with some automation and AI support. Of course, the issue then would be about privacy, data governance. So where is the data staying? Where is the data or the information you collect about the campaign coming from? Where is it staying? If you're using commercial platforms like Meta, Google, or Anthropic, the question is always eventually where is this information going to go, which servers. There are like governance not only at the GDPR rules, but it's also about what is the data used to do so, to do, is it used to train the model again, or is it safe somehow? Now, whether you trust that, or that we should trust that information on that discussion, I'm not sure. So we need to also be cognizant of that. And then might be unintended effects of the system that might miss that, because it's that the agents and the generative AI tools are designed to look at specific aspects that might not be incorporated in the strategy, that we miss out. And then this, of course, will probably also lead to increasing divide in digital divide, health literacy, and digital health literacy in the target populations we are serving. So if we are designing an intervention that is inclusive by design, we need to be aware of that from the beginning. Yeah. Finally, of course, the reduction to or over reliance on generative AI tools on automation might pose some challenges in terms of delivery itself. So should we trust or not the bots that make decisions, or the agents that make decisions on their own? I'm not so sure. All right. So there are issues that might prevent us from doing it. I'm more on the positive side overall, but at the same time, I'm saying I'm conscious of the limitations and the risks that these technologies carry, even when it comes to simple automation. So we need to exert extreme caution and presence in the process. So as we humans, developers of campaigns, campaign health communication professionals, and researchers. So the model is usually human machine teaming, not automation. So we need to own the judgment, and we need to make the final decision, say, okay, go and do this now and show me what you did, and then continue. So AI does the heavy lifting. So it's good to say, well, I can delegate some of the tasks that are mostly maybe time consuming. At the same time, we want to maintain overview and information around what we can control. So we need to be supervising the output, supervising and safeguarding what we see. Now, of course, the rationale is that everybody is using generative AI tools. Creative agencies are using these tools. The researchers are using these tools to develop content for health interventions. So this is something that I showed a couple of papers here that they talk about the superiority of content generated by AI compared to human. When it takes more time, it's much more effortful, and so on. So as I said, there's the assumption is that everybody is using these tools. Now, the question is, how are you using these tools to be efficient, to be effective in our work? And then when it comes to low resource settings, so in low income countries, and also I would say in high income countries, public health units tend to have a little money to spend in communications. Um, and so it might be useful to use some of these generative AI tools to get some ideas and develop some creative strategies. That might be useful, might not be the end result, but at least you can get something that, unless you are in, unless you have the skills of a graphic designer, you might not be able to develop. So there are 6 benefits, at least for me, in bringing AI to social marketing. You can get personalized support, in a campaign that is running. You can increase the scale and the reach of a campaign because you have the possibility to develop more messages for more people, and you can develop a strategy that can reach wider audiences. You can monitor and tackle engagement, because you can have different agents responding to different queries, creating some interaction, right? This maintains interest because you can produce much more content in terms of volume over time, and because there's a sort of a dose response effect between exposure to pro-social behaviors, pro-environmental behaviors, pro-healthy behaviors, and the health outcomes. Therefore, you can say this might be a good way to invest some money. And of course, when it comes to data analysis, big data crunching, as I said before, AI can also help us identify trends and respond more quickly. So we're building together now with some colleagues here in the University of Birmingham a project, an idea on how to detect misinformation related to MMR vaccines through AI and by scraping social media, and so crunching a lot of information, a lot of data, a lot of posts, to detect what are the salient misbeliefs or misconceptions. So then this will be very helpful then to build communities of support and manage those communities with the help of these synthetic agents, but at the same time they are backed up by real humans. Yeah. Now, reflecting again on the different functions of say of AI, I'll take a look at the one of them. So in the first part of the process of developing a strategy is audience insight and formative research. So when you can use AI is maybe in evidence synthesis, so scanning and summarizing literature, or social listening, as I mentioned before. Social listening is the practice of looking at social media, for example, social media posts to understand of an issue or an underlying discussion or narrative around the topic that we are working on. We can make segmentations that are more precise because we have more information about the audiences, psychographic behavioral data, not just demographics, Then we can take a look at the competition analysis. I'm using social marketing terms on purpose, but at the same time, it's important to narrow down the elements we're looking at. So what are the behaviors we are trying to promote, and what are the competing behaviors, so the behaviors we try to discourage. And then, of course, we can create and use synthetic personas. We can define, based on the information we have, based on the huge amount of information we have, we can define precisely or more precisely ideal personas or the target audience we have in mind with the help of AI. And of course, then we need to be careful that, of course, these synthetic personas are just there to inform. They're not representing real people, but they're an ideal persona. And this, by the way, happened even before AI. And now with AI, you have access to much more information, and you can condense and synthesize. I think this is the key aspect. And then training data, training the software and the agent itself might take some effort, because you might leave someone out. You need to be cognizant of that. We need to try to remove as much as possible biases by introducing data that belong to a segment of the population you want to target, if you have this information, of course. The main issue, I think, will be always to trace and claim back to its source. So asking the agent always to verify this information, because generative AI, especially tools, generate things, to generate responses. And these responses might not be based on evidence, may just be generated because they are plausible, because they are statistically appropriate from the model perspective, not from the response perspective. So asking always, give me an evidence, give me a response that is backed by evidence, backed by a real study or a real information, real report. Now, second element, let's say related to strategy, is where we can bring together the theory, let's say, and the intervention mix, which is, in this case, for example, a theory of change. So we have in mind an explanatory theory that tells us what to do to promote behavior change. We know what the drivers are. We know the capability, the opportunity, the motivation. If you want to use the Suzumiki and colleagues model, we know the behavior change techniques that are useful in that context. You can say, okay, based on this information, develop a positioning statement. Tell us what you think. Tell me as a developer. Tell me what you think might be the best way to position the behavior we want to promote, and then generate messages accordingly. So then we can look at different intervention tactics, let's say, or different foci of intervention. So you have information, it's about awareness raising. The education is about competency building, skill building. The support is about, considering interventions that promote the reinforce behavior that is already existing. Designing is about creating the environments, the infrastructures. In some cases, we can talk about nudging or creating the choice architecture around the behavior. And then controlling, nudging, incentivizing, and disincentivizing are the tactics we can use to promote an active decision over a passive decision, and over a reward, the incentive, or a punishment, the disincentive. Now, when it comes to creative concept and message development, AI is very, very helpful because it helps tailor messages, not only target. It creates more precise, it can help prepare more precise messages that are appropriate for different segments of the population. Of course, we need to guide the tools to say, I have these segments in mind, these are the information, these are the insights I got from them, and then I want to have these even translated. Okay, so translations, of course, caveat being, we need to be careful that not all translations are accurate. So we need to double check that the translated document is really actually in and is correct from a linguistic standpoint. So you need to have a person from that language to tell you whether it's true or not. So that the tool can help develop concepts from a creative brief. And I'll give you an example in a few, in a minute or so. And then you can create different variants, basically in a few seconds, of a message. So if you're saying, I want to test this kind of framing versus this other kind of framing, so what we call in marketing A/B testing, you can do that. And you can do multiple times of that, infinite. No, probably not infinite, but many times. And there's a couple of publications I found the other day on AI generated content and how these can be very useful in on developing social media content and for campaigns. Let's say it is an example for cancer prevention, using influencers to target risk groups on social media. And again, here the highlight is about low cost, because indeed we're talking about cost savings and being efficient. And here is where generative AI, with the co-design with youth, so with the humans in the loop, created different vaping awareness advertisements. And here they represented, the authors, different phases. As you can see, there's a mix of developing some text, then there's a focus group with validation somehow built in, text image generation, again with some, again, refinements, and then judgment and validation again. So it's particularly interesting approach. Yeah. Now let's get into it. So let's take a look at how we can use, with an example, generative AI tools to create something, to be really producing messages with a specific guidance. So in this case, I talk about creative briefs that are tools that are bridging the research, let's say, and the creative development, always been there. It's nothing new. They are the foundation for a strategy from a communication standpoint. So there's a contract between an agency and the client, which might be, you know, a local authority, public health organization, a non-governmental organization, or a private organization when it comes to health promotion, behavior change. Now, a template looks like this. So there's a definition of the target audience. What are the objectives of the campaign, of the intervention or the program you're promoting? What are the obstacles or what are the barriers, the perceived barriers? This is all informed by the insight and the formative research you might have done, or by the literature review that you might have done on the topic. What is the key promise? What's in it for the audience? What is the benefit they'll see? What are the supporting statements? So reasons why the key promise is true. And what is the tone? So is it friendly? Is it very authoritarian? Is it direct? Is it simple? I don't know, different ways we can do it. Then what are the channels we want to use? And what are the openings? What are the teachable moments? What are the opportunities we can use? Let's say there's an event in that city we want to leverage. And what are the potential creative considerations that the creative team should always consider? Just a work example. So I develop a prompt for AI. So act like you are an expert in advertising and marketing. You are a creative director of a famous advertising agency specialized in social causes. Sorry, I'm going to give you a creative brief to help us design our communication materials. The creative brief is below. So our target is adolescents in the UK who are currently smoking and who can start smoking. Our target audience is influenced by peers, by cultural norms, social media, and advertising. They are stressed and consider smoking as a coping mechanism. They do not know about the consequences of smoking and probably do not care too much about them. Smokers have developed an addiction, which means chemical and behavioral addiction. Our campaign aims to A, prevent new smokers from starting, B, reduce the incidence and prevalence of smoking among our target group. What are the benefits? We want our target audience to see, to believe, to think that not smoking leads out to happier and healthier and longer life. And these are the benefits that we, social marketers, health communication professionals, we gained from talking to the target audience, engaging with conversation with them, studying them, doing surveys with them, and so on. So this is something not automatically generated. So I developed this brief with data in mind, okay, with informed data by information that I collected before. So smoking is a known from the scientific community a risk factor, of course, for cancer in lung in particular. So we want the message to be motivational and empowering, but friendly and informal and positively framed, so that we don't want to preach this audience. We want to diffuse these messages through ads on social media platforms, but also printed materials. So we'll have school events and posters in local cafes. We want to do it. So then this prompt is, can you suggest any messages and visuals for these campaigns? And think carefully before replying. This is just a way to prompt the deep thinking of the machines. Even though deep thinking doesn't mean that the machine thinks, it just takes a bit longer to understand the task and to develop an output that is more accurate, more precise. So I did try, I recorded this on ChatGPT and on Gemini. So I used the GPT called marketing. So I pasted that the prompt is also the long prompt with the creative brief, and this is what happened. So it took a few seconds to actually go through response. This is ChatGPT. This is the basic version. So it didn't take long to develop different themes, as you see, freedom, future self. So this is about, you know, imagine taking the perspective of the adolescents here, and then, you know, develops a lot of themes. Actually, developed 8 or 9, yes. And then it always talks about cancer fear, then social media friendly, and so on. So developed a lot of ideas here. Then I want to skip a bit down towards a strategic recommendation. This is where I am particularly interested in saying, you know, so I would center the campaign around autonomy and identity, which is something that I mean, it's arguably accurate. Let's say with adolescents, this is, the health argument will not work. And then I asked to generate some visuals for each of the channels. Then it took a while to think about it. This will take about a minute. And then I want to show you some results here. Let's see if I can see them here. Okay, so maybe the screen is too small. Now I make it bigger. So as you can see, develop different visuals on your future. So you are more important, or above the nicotine as an addiction. You are more important than nicotine always. So as you can see, there are lots of ideas here. They seem quite well. So ChatGPT in this case uses DALI or the GPT marketing uses the image generation of DALI. This is part of OpenAI. It's free again. And so you see different versions, different options, let's say, for different segments of the adolescent population. So I could have been more precise and say I want um, this age group, and I want maybe high school goers in the UK. So I can be even more specific. But overall, I think as a starting point, it's not bad. Again, as a conversation starter, so if I go back to the advertising agency that might charge me twice for the same amount of work, and that will do it anyway, I can go to them saying, look, I have these ideas, I like them, I validated these with a group of the target audience, and I can save them some time. Now let's take a look at the other one. Sorry. Gemini, so Flash 3.5 thinking level extended. So I asked the tool to think a bit more about this. I wanted to have a more precise response. As you can see, I paste the same prompt, and then it goes back again, develops a few concepts here on your calm, and talk about calmness. Now it's think about the insight that they can have. Again, this is all generated, of course. There's no insight information. I can provide this though. Don't let them script you. So it's about independence, level up your life, and execution of for the campaign. So this, yeah, which of these directions feels like the strongest for you? So give me three options. And well, I think let's go with the first one, I think I said, and then build the first one, yeah. And then it develops further our own calm, then social media strategy. So it says goes by channel. So TikTok, Instagram, Reels, and Snapchat. The visuals, it gives you a storyline, which is very helpful. So again, this is, even though it has not yet generated any visuals, this is very, very useful for a creative agency, because it gives a draft to work on. And then it provides again other potential messages and different channels. This again quite fast. Then I ask, can you create an image? So I asked specifically to use the image generation feature. Now use the information above to generate some visuals, and then it goes on. It takes a bit of time, and as you can see, it generated some visuals that are not the same as the previous one. So in this case, ChatGPT and Google Gemini think a bit differently, as you see. I mean, the models are different, yes, and they generate something else. I mean, it's a bit more positive, at least. The colors are a bit less dark and gloomy. Um, and then you see they talk about breathing deeply to clear the smoke, and so it uses this metaphor, if you want, pure vibes, no filters, no hidden cost. So it tries to highlight the different benefits that these target audience might see. So then I asked for posts to be printed on the billboard. So again, I asked for specific type of formats, and then went on to think, and again, with the same color palette, with the same messages, um, providing as billboard and posters for that can be used in outdoor spaces. So as you can see, it's quite interesting. Then break down the visuals for different channels and different segments. This again, I didn't specify the segments, and this is what it gave me. Social media engagement, acquisition, so mobile first. So the posts are like square for Instagram, for example, Facebook or TikTok. And then you have billboards, outdoors, community, and so deep engagement and merchandise for this movement, if you want, which is something that I didn't ask ChatGPT, but this is something that Gemini produced. Um, so overall, I would say, oh, this is again doing it. Okay. Um, I was particularly surprised and positively surprised. I mean, I've done this test before, of course. I was using even the same prompt, and I noticed that much more improvement in the way ChatGPT has done and the way Gemini particularly has done. So I haven't tried other tools. I'm planning on testing a bit with Claude, even though Claude, I know it's not great for not that great with image generation, even though they have an agent or a software that is for design. So I need to see if that is good. But even though, for example, Canva, for those who are familiar with the software, Canva is increasingly using AI to uh, to adapt templates that they have available for social media. So if you have already in mind what to do, what to ask, you can type this information and the software will give you some suggestions. So again, there's a big shift towards more AI prompts and AI support in software that is also for creative design, design for creative design. Pardon my pun. And so when it comes to delivery evaluation, so conversational delivery, so chatbots, so we can create a chatbot trained on data that we can control, so in a closed system that can collect some data scale. So I mentioned the example, MI, is a mobile intervention for family planning that we ran a few years ago in Lebanon. There was a chatbot that was closed somehow, so there was not generative AI involved in that sense, but we could create a data bank of messages that we can ask the software to create every time there's an input from the user. So that helps scale up the intervention without actual human being there to interact with the users unless it's needed. You can create personalized prompts that respond to behaviors and habits. So depending on the information that you give, for example, I noticed recently on some apps like MyFitnessPal, if you enter a specific food, it gives you an automated prompt or nudge, let's say, for your use, and it's AI driven. Of course, the more information you have, the more they can say there's a trend from you. And you can continue doing this behavior and so on. So these are adaptive nudges. And of course, it's all good for goal tracking, self-monitoring of behavior, so sustained engagement, sorry. There's always something that we can leverage instead of asking humans to do it all the time. And of course, when it comes to evaluation, we have real-time data that we can capture and with AI assisted coding of open responses, for example. So if there's a mention of a keyword that can be flagged, and then a tool or an agent can flag the response and then suggest, should we do it now or not? Of course, with human oversight. So now, going back to a conclusion, let's say it was a conclusion. So we know that there are risks, of course, and there's bias in representation and the training data and so on, the potential hallucination, so the creation of content that might not be there, that might not be real, especially when it comes to academic content of references and things like this. There's a problem, of course, of privacy and governance. Are we sure we can use the data the way we're using it? Are we allowed? And are we can we trust the organization protecting that information? There's a problem, of course, on equity and the digital divide. So if we are creating an intervention for social media users, maybe we are looking at a group of people that are tech savvy, that are probably already aware of an issue, then we might losing a big chunk of the population that we are supposed to target. We need to really question our approach in the first place. Then we tend to over-rely, of course, the risk of over-reliance on these tools for many things, so which might reduce our skills in responding to future threats if these tools are removed for various reasons, for bans or for we end up not paying the subscription because it's too expensive. And transparency, of course, disclosing AI use and keeping a human accountable for this. We are responsible for the outputs eventually. It's not the algorithm or not the AI tool that is responsible. It's our responsibility. So this is something we need to consider, of course. Just to conclude in a way, also on a sharper note, so for the platforms, so generative AI platforms, OpenAI, I want to make the names, OpenAI, Anthropic, Google, and so on, are commercial actors. So at the moment, they offer these tools at a price. Sometimes it's free. But soon they might start charging us for it, and they might start introducing, some of the plans are introducing advertisements to cover the cost, because the cost of running these models is increasing. Cost in terms of money to run the model behind and to store the model somewhere in large data centers, because they consume a lot of energy, they consume a lot of electricity and water to cool them down. So there's an environmental impact we need to consider. And the price for that we users will probably need to pay. And this is a problem. So we need to acknowledge that there's a commercial determinants lens, commercial determinants of health lens we need to consider here. Now, in terms of working principle, for me, for responsible use we need to keep the human in the loop. A person is accountable for a group of people, of course, accountable for every decision and output they produce through AI. We need to verify before we publish. We make it clear that we need to trace the sources. We need to verify this information. We need to fact check anything that is particularly health related. So we don't want to diffuse misinformation if we don't verify this information. Yeah. And then we want to match the tool to the level. So what do we need to use the tool for? What purposes is the tool used? Is it for policy development or policy analysis? Is it for strategy development? Is it for delivery? And of course, we need to acknowledge the different use and different limitations for each. And we should build capability, and this is where I usually talk about skill building or a critical AI literacy building, if I am allowed to say so, because we need to be more cognizant and aware of the pros and cons of generative AI tools, such as any other tools we are using, with all the limitations and the opportunities they share, as I said before. And I would say last, we need to document AU, so we don't have to be scared of reporting this, to be transparent and reporting, saying how we use it, documenting which tools we used, when we use them, what prompts we used, because every time we use a tool, even with the same prompt, we will obtain different responses. They might tend to converge, but nevertheless, it is possible that the responses are different. So that means that not always the prompts can be verified or then replicated, because every one of us using a tool will have different responses. So there's within subject variability, and then between subject variability. So in conclusion, we said that AI for me is a teammate, like a co-pilot, like Microsoft wants us to call them, not an autopilot. So we need to again bring the human in the machine team. So people keep judgment, ethics, and accountability. So the responsibility is ours eventually. So AI creative in the creative process works at many levels, of course. It can reshape policy, strategy, and delivery. So we can also plan for all these three levels, and we need to be very good at understanding where we can use some tools and where we cannot use others. So it works, it is useful, it is efficient, time and money efficient, but of course we need to be present again. Number one, yeah, AI is a teammate. We need to bring the human in the loop. And the tool is also part of the system. So we need to acknowledge that the platforms we are using now are owned by commercial entities that might disappear or they might be banned. So we need to also be cognizant of the power they exert on the society and the limitations that they might have, and the harms they can create. We can look at the positive, of course, but we can also think and consider the negatives. Just to conclude here, just because I mentioned social marketing many times, I'm running some webinars and a course on social marketing, training opportunities here. I leave the slide on for a moment. There are discounts for low-middle income countries and students. So if you're interested in, take a screenshot on the right-hand side with a QR code. If you want to enroll in the online course, then there's a QR code on the left. And of course, I'm here to, you can contact me if you are willing to attend these courses, of course. I close now and stop sharing, perhaps, or actually I can see if we have any questions from the audience. So feel free to raise your hand and then someone will give you the opportunity to speak, or you can type in the chat. The people that were to leave before, I see the comments. Are there any questions, any concerns or experiences you want to share of AI use in your own profession? Yeah, stop sharing now. Or some people leaving. Right. If there are no questions or no comments, we can also close. And I would just say thank you for attending so far. If you're interested in joining the network, the SPHR network, we'll leave a link in the comments on LinkedIn usually and on YouTube on the channel when this presentation will be reposted. Okay, thank you. Thank you, Stephanie. Thank you, Ben.
Thank you so much, Dr.
Oh.
Marco. It's good to see you. We'll get in touch.
Yes, absolutely. It's good to see you.